all. Thanks so much for joining us on Speaking of Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Asif Merchant. He is the chief of geriatrics at Newton-Wellesley Hospital, the chair of the Geriatrics Committee at Mass Medical Society, and an associate clinical professor at Tufts University. And it was fascinating to talk to him about the field of geriatrics because geriatrics definitely has been in the spotlight over the last year because of all of the nursing home issues with COVID. But I didn't really realize that there was such a struggle with resources and staffing and everything else basically in that field until then. He was saying that the field continuously, the number of treating physicians has declined in 20 years. I think it's gone down close to 3,000 members, which is unbelievable because the number of aging people is going up and up and up. And so it was a really fascinating conversation to me, just hearing about the struggles being a geriatrician and overcoming, I don't want to really say a stigma, but kind of a stigma within that field that he said other doctors didn't feel like, it seemed like maybe he felt that other doctors who aren't in geriatrics feel like maybe they'd be limited, that if they pursue geriatrics, that they're going to be working in a nursing home only. And that's their whole thing. But he said, there's so many options. You could do consulting from primary care. You could work with psychiatrics. You could work in a nursing home. You could work in assisted living. There's different fields and different options. And so to me, it sounded like he was really, putting a call out there to other people saying, hey, it's not a bad field. Yes, there's some sad things, but all parts of medicine are going to be sad and scary sometimes. But it's a really great field and these people are really great and they deserve the specialized care and we're all going to be there. Apoorv, what did
I
you think?
agree. Yeah, Stephanie, I agree. I think that he had a great message. I found ultimately of, let's say, quiet hope. I think that despite all the challenges during COVID, and he's probably seen it all, being trained as a geriatrician, learning how to deal and work in situations of limited resources, he somehow has figured out how to help the facilities and help the patients and help the communities. I thought that was a really powerful message. I really like his ideas about in geriatrics, you don't have to think about it as limitations because there are so many places you can practice. I like his emphasis on education paradigms having to change and partnerships with health systems having to change. I thought that was another great message because that's certainly what needs to happen in the future if we're going to actually develop more consistent, what we would like to believe is higher value care. It can't simply be a health system then just transferring patients off to another facility, and then it's a black box. They don't know where the patients are going to, just what he was alluding to. Health systems have always treated things that way. It's just kind of the next place down the hill where people go, and maybe they come back, and maybe they don't come back, and maybe we don't want to know. So to me, I think his whole approach to developing systems of care and particularly the way he's gone about building his own career in terms of becoming involved with these national societies and state societies and making sure that he's advocating for the right resources. So to me, it felt like a great message of hope about how to bring about the same level of discipline and passion within the long-term fields as there is in the rest of healthcare.
Absolutely. And collaboration. He mentioned that, focusing on health. He mentioned I don't remember which organization it was, but he said that one of them actually changed the name to become more inclusive so that it can include people like NPs, he said, who are doing a bulk of the work in these places. And so again, the theme that we continue to hear through everything is collaboration, collaboration, collaboration.
So true, so true, and resourcefulness. And it's great to meet Dr. Asif Merchant and see that he's out there trying to really band together and create change in the communities.
Absolutely. Well, thank you so much. I hope you stay tuned for the interview on Thursday and we'll talk to you soon. Bye-bye.
Bye bye.